All right, wonderful. Welcome to our presentation. We called it House of Health. I really enjoyed collaborating with our team to come up with the name for our session. And so we'll be focusing on health science non-degree program. And we do have another staff member here, Paul Jenkins, with us. He's going to be helping monitoring the chat. So if you have any questions, feel free to put your questions in the chat. You can also raise your hand virtually or feel free to unmute and you can ask the question at any time. Very flexible with however you'd like to answer get your questions answered. So these classes can be for those that are already in the healthcare field, looking to enter the healthcare field, or even just if you're kind of thinking about entering the field, great resources for that as well. Actually, just one second, like have the wrong work one in here. Switch over to my updated version. Wonderful. All right, so my name is Samantha Bray. Can everybody see the screen, the PowerPoint?
Yes.
Okay, great, thank you. I always like to make sure you can see what I'm seeing. Wonderful. So my name is Samantha Bray. I'm one of the coordinators for Health Science Non-Degree Program. I am located at the Scott Northern Wake campus, and that's at 6600 Lewisburg Road. We also have another coordinator, and she is over at the Public Safety Education campus. This is my direct number and email. I will also put in the chat at the end our department phone lines and emails. Typically, I'm reached a little bit better by email, just I'm out of the office sometimes. But also, if you call one of our department lines, one of the other people in the department will likely answer or give a call back. So phone number direct 919-532-5844 and SC Bray, S as in Sam, T as in cat, B as in boy, RAY at waketech.edu. So here are some of our classes that we offer. And so we'll have 2 slides for this. And then also in addition, I don't have a picture for it, but nurse aid is also included under our department. So we have central sterile processing technician, probably one of our most demanded courses and fills very quickly. Clinical research specialist, digital billing and coding, EKG technician, fitness trainer, healthcare billing and coding, also imaging, massage therapy, medical scribe, NCFAS caseworker, neuro, phlebotomy, and then as I mentioned, nurse aid as well.
Hey, Samantha.
Yes.
Real quick, I'm still seeing your introduction slide.
Oh, okay. All right. Do you see it, the introduction still?
I do.
Okay, and what about now?
I am still seeing the introduction slide. Is anyone seeing something other than the introduction slide?
This is Adriana. I'm seeing all of them.
Okay, so
Like
just
right
me.
now?
I'm seeing medical program. So it's showing the different breakdowns of the medical
Yeah.
programs.
Okay, that's great.
Perfect, wonderful. Thank you, Paul. Always good to double check. Technology is great when it works, and when it doesn't, we have problems. So thank you for letting us know, and Ronnie, that was you that said you were able to see them. I appreciate the input. All right, so our class format. Most of our classes are either going to be online or a hybrid or blended component. Some of them are all seated, but just a select few. So seated will all hours be completed in person, online, all online, and in the spring actually will be fully over into Blackboard with all of our courses. Nurse aid may still be in Moodle for a little bit of time, But what's great about that is the learning is at your convenience. You can log in at any time. There's no specific time to log in. And then you would just need to meet the instructor due date. So a lot more flexibility with scheduling. A lot of people work during the day or in the evening. And so they're able to do it when it's convenient for them. And then hybrid or blended. So the hours mostly are, will consist of seated and have an online component. So if it's hybrid, you'll have more online. If it's blended, you'll have more in person. But either way, you'll have the meetings of both. And like I said, those will be in Blackboard, except Nurse Aid for a little bit of time may still be in Moodle. So you want to make sure that you have a computer and also a good internet source and then Microsoft Office product, which as a late tech student, we do have some resources for those, for some of those as well. So the difference between our programs and workforce continuing education as a whole versus our curriculum programs, we don't offer a degree in our classes, but we do have industry recognized credentials for most of our classes. So you would take our class, you would then be eligible to take the certification exam and then enter the workforce. There are some of these courses that you'll learn, you may not have to be certified in them to enter the profession, but it may be preferred or you get a higher pay with having that credential. So some additional information that people typically want to know before they know anything about the classes. So the course cost, it ranges from $180 to $250. Potential additional costs for course materials or like transportation, books, the exam. And these courses can be completed between 2 months to 12 months. So for those that are looking to make career change or unemployed, maybe even you're just kind of looking at doing something different, maybe down the road. These are great courses and with a short period of time can be completed and entering that workforce. We do have financial assistance that is available. This is a screenshot from the website previously from last year, but this is a initiative that you can apply for. And if you're eligible, that department would help you register, and that typically will cover the tuition and your textbook. We also have other assistance where if you need a laptop, you can apply for a laptop. And sometimes if you need either a loaner laptop, sometimes a hotspot, you'd also have those options of checking those out from the library. So different options for that. Currently, the form is closed, but the website is waketech.edu/free training. I'll put that in the chat as well. That way you can have that there. So that primarily applies for programs that lead to a certification. So they would let you know if you are eligible or if you do not meet the criteria at that time. So a different department would assist with that. If you apply, we don't know that you've applied until they let us know that you're registered for the class. So where to get started? A lot of our students like to take medical terminology. It is a prerequisite for some of our classes, but even still a great foundation for any medical class. So we offer them all throughout the year. Career exploration courses, and not just for the medical field, for a lot of other professions as well. We have a great career services department that offers career exploration courses, and they offer 2 specifically for healthcare. They offer one for phlebotomy, and I think they started offering one for dental hygiene as well for the medical field. And careerservices.waketech.edu. Also, another class that can be really helpful. Our department does not offer it, but I still like to promote it. BLS for healthcare provider, basic life support for healthcare providers, so CPR, healthcare provider, BLS for HPC. Then it has to be through the American Heart Association. That is the standard for our clinical site. So that's not us saying it has to be one or the other, but they are requiring American Heart Association. This is required for some of the certification exams. We also offer these classes along with other different types of CPR classes, cpr.waitech.edu. All right, so to the basics of each class. And again, if you have any questions, feel free to raise your hand, unmute, put your question in the chat. We'll also have time at the end to ask questions as well. So Central Sterile Processing Technician, this is a high demand career and it's offered through multiple employment opportunities. We actually just spoke with someone from Duke yesterday, and they said they had a really big need for sterile processing technicians. So even in our area, as well as all over the state and probably across the country, you'll see the same for that. So what you'll learn in the class, learn the primary responsibility of a central sterile processing technician, the practical application of learned concepts, and then you'll go into more detail about sterilization, disinfection, storage and distribution of instruments, inventory management, quality assurance, and more. So this helps you learn a lot of that behind the scenes for hospitals or sterile processing facilities. So maybe like when you go to a doctor's office, you sometimes see them opening the tray of instruments and it's in a sealed package and they open it so that way you know that it's sterile. And then this class for meeting times, they meet online for the first day, and then they meet 2 additional nights in person at the Perry Health Science campus. So the rest of it will be online through Blackboard. So people in the area, all over the state, even sometimes out of state coming to take this class. It does allow up to 20 students. So if you see the class, go ahead and register for it. We do try to offer them about every 2 weeks. The certification exam is offered every 3 months. So the courses may not align exactly with the exam date, but we do want to get people in the class and get prepared for the exam. Clinical research. Oh, sure. Ashley asked, would taking the medical terminology course be beneficial in regards to this? So for sterile processing, really for any of these courses, primarily I would say EKG, phlebotomy. There's 2, the healthcare billing and coding classes and medical scribe. Those 2 require it. Any of these really, if you're interested in the medical field, it will give you a good, strong understanding. So it may not correlate directly with sterile processing or maybe some of these other classes, but there may be some information that you can rely on. And also definitely helpful if you advance to a higher level position. So we offer a surgical technician program, but it's only offered to our hospital employees. The hospital tells us who they're spending. And so they want to go farther and go into anatomy and physiology, as well as medical terminology. So it really is a good start in addition to, maybe not currently for that specific course, but going down the line with when you're looking to advance into your career. Does that answer your question, Ashley? All right, wonderful. So for clinical research, so what's great about living in our area here, the Triangle area of North Carolina, is the world headquarters for clinical research activities. So you're in a great location for the field. You could not ask for a better place to be. So we do have 2 courses that are available for clinical research. We have the Healthcare Clinical Research Specialist and then Monitoring Clinical Trials. The Healthcare Clinical Research Specialist is a prerequisite for monitoring clinical trials, unless you already have background doing clinical trials. So this is a industry that can be a little tough to get into, but there are people that are not certified yet that are working in the field. And then for the exam, you can do a little bit more research, but you have to either have a degree, being full-time or part-time or a mixture of both. So this class is a great introductory course into clinical research, but also can help prepare you for the exam. So the healthcare clinical research specialist covers fundamental clinical research concepts, as well as how to structure and execute clinical trials, navigate the requirements, and then collect and analyze clinical trial data. So if you're really good at data, whether that's surveying for the data and then interpreting the results, great industry to enter. And then the monitoring clinical trials goes a little bit deeper into the clinical trials, further into the regulatory requirements for monitoring, how to conduct site visits, and then how to report findings to sponsors. Dental billing and coding, we just added this class over the summer. ECU Dental School reached out to us, seeing a need for their students to have a stronger background in dental billing and coding. So we figured, why not just offer it for everyone? So billing and coding specialists are essential for dental operations, and positions are in high demand. You may see this person also doing like the receptionist, the office manager, person working at the front desk. So it could be different roles, and similarly also for the healthcare billing and coding. And we'll talk a little bit more about that. So this is split up into two courses, dental terminology and dental billing and coding. We have people that have been in the dental field and tried to skip the dental terminology and thought it was a little bit more in depth than they had expected. So it covers not just different procedures, but also specialties as well. So it covers dental terminology as it relates to procedures and services, techniques, materials, and dental diagnoses. And then it goes further into the dental billing and coding, which talks about the dental revenue cycle, dental insurance types, verifications, breakdowns, estimates, and how to avoid errors when filing dental claims. So that's very important. You may see when you get something from your insurance that says have like a little error code next to it, and then something just wasn't billed correctly or the wrong code was used. So very important. EKG, so this deals with the heart. So students must be proficient in the English language. Again, medical terminology is recommended prior to taking, but it's not required. High school diploma or equivalency is required for that certification exam. So we try to get students that already have it for when they take the class. So what you'll learn the anatomy and physiology of the heart, principles of the EKG, heart rhythms, heart blocks, bundle branches, and how to operate the EKG equipment. And then further, you'll learn how to read the script. So during the class sessions, you would take the leads, I would call them stickers, but they're leads, and place them on your classmates, or if they have a mannequin. And then you would learn how to read the script. So then you could put that in someone's chart, talk to the doctor, the physician. You have different options with that. That class does meet once a week. The hours and days may vary, but once a week. And will either be at the public or the Perry Health Science campus or the Northern Wake campus. And like I said, once a week, and then the rest will be in Blackboard. Personal fitness trainer and group fitness trainer are the two that we are currently offering. It is through the American Council of Exercise, and the instructor that teaches this course is full-time on the health and fitness side for curriculum, and she is certified to teach through the American Council of Exercise. And it helps you design fitness programs based on your client's needs, fitness levels, and goals. So if it's personal, you're going to have a one-on-one. And then if it's group, two or more. So typically you may see more than two people, but you're gonna have multiple people to work with. We're also trying to add a pain-free performance specialist certification. One of the adjuncts through the health and fitness side proposed this class to us, and we're trying to get it up and running. So it will help optimize professionals to optimize their clients' fitness and performance around common presence of pain, dysfunction, and injuries. And sometimes these are injuries that may not be visible. Healthcare billing and coding. So this is similar to the dental, but for healthcare. So going to your doctor's office, maybe a urgent care or an emergency room. The program outlines medical terminology, healthcare billing and coding, or healthcare billing, healthcare coding. We are changing that, so you may see it listed as medical billing and medical coding for the spring. And this prepares you to accurately locate documentation in the patient's records to support coding processes and assign codes for diagnosis and procedures. And this also helps with medical charges to insurance companies and the medical insurance cycle process. So this aligns with 2, maybe 3 certifications. So you can take the professional biller certification, you can take the coder professional certification, or you can do a dual certification for billing and coding. So different options for that. And it is encouraged for you to take healthcare billing prior to healthcare coding. Intro to sonography. So if you're interested in our curriculum sonography program, this is a class that you can take to earn competitive points. So one of the instructors that teaches this class also teaches in the sonography program. So it's great to have someone that's in the program teaching the class. And the topics that are covered: applications, terminology, history, patient care, ethics, basic skills, and preliminary screening techniques. So you see that they have the image on the side there where piece of the equipment is on the person's body, and then it shows the image inside on the screen. And so you'll get to learn the different ways of using the equipment and the other topics there. And you'll see a lot of these courses have overarching themes, but are pertinent to that specific class and that industry. Also, a high school diploma or equivalency diploma is required to register for the class. That's because primarily working for those that are interested in the sonography program, and it's a requirement to have that for the program. All right, massage therapy. This is broken up into 2 classes. This is also a class that you cannot just simply register for. There's not necessarily an application process, but you can put your information on an interest list with the program director, and she will let everyone know when orientations are. You would attend the orientation session, and she would go over there to vet the applicants for that class. So broken up into 2 classes. Currently, it's more like a full-time program, Monday through Thursday. We are looking at a few different options for a part-time option, because we do understand trying to have flexibility with job, childcare, and other personal matters. Oh, sure. Let's see if possible to revisit. I can go back real quick, Lindsay. We're trying to go back real quick to the intro to sonography for Lindsay, not a problem. So this is a class that is for the sonography program. So if you're interested in sonography for that degree, you can earn competitive points. So that way you can work towards getting into that program. The topics that are covered: application, terminology, history, patient care, ethics, basic skills, preliminary screening techniques. And if you look over at the image on the left-hand side, you'll see where the equipment is on the person, and then it shows the image inside on the screen. So also a high school diploma or equivalency is required to register for the class, because it's primarily for those that are looking at the degree program, and that is required for the degree program. So in massage therapy, part one, they cover the massage theory, Swedish massage, heated massage, anatomy, physiology, and pathology, law and ethic and therapeutic relationship. Again, remember I said overarching themes that you may see in different classes, but are pertinent to the individual class. And then in part two, you learn a few more different massages: sports massage, hydrotherapy, kinesiology, deep tissue and trigger point massage, prenatal and infant massage, geriatric massage. Then it goes into Eastern body work, business practices. And the best part is you take those skills that you've learned in the classroom and during your practice, and you'll get to have a student clinic where you're able to give massages to different patients, people that come into the student clinic. And you'll also learn and practice for the certification exam and review for it. So not only does it help you do the practical application, but also prepare for that certification exam. And I will put Nancy's email in the chat for anybody that's interested. Double check her email. So you would just email Nancy and she will add you to that list. They just started the massage therapy one class, so it'll likely be mid next year when we offer the next massage therapy one class. Medical scribe, medical terminology is a prerequisite. And this is a newer class also that we developed. The instructor actually is full-time in our medical assisting program on the curriculum side. So you may hear me a lot saying that we have similar instructors on the curriculum side and the non-degree side. And that's great because we are able to use their knowledge and also have good college level courses offered, and they have the background for it. So it's nice to get their perspective as well. So if you like note taking, completing forms, data entry, a great position for you. You learn how to chart physician and patient encounters during medical examinations or procedures, and assist the physicians and patients by locating needed information and completing forms. So we have a question in the chat. I believe these are being recorded. Paul, you may, are they going on the YouTube channel or like a specific website? The videos from our presentations.
I don't know the answer to that. I know they're being recorded and then they'll be shared out from there.
Perfect. So I think they'll send a link where they're uploaded, whether that's on SharePoint or YouTube channel, to everyone that pre-registered for open house today. So no worries if you're just joining us as well.
Okay, I'm sorry. I missed that. My name is Kamika. I tried to get into the class, but nothing that they sent me would work. So I was trying to find out when the next event was, and it says massage therapy. Is that the next event topic?
So that was the one we just covered, and I put the program director's email address in the chat because it's not a class that you can just register for like some of our other classes. So you could email her if that's what you're interested in to get on that list.
Okay, thank you.
You're very welcome. NC class caseworker, it may also be labeled as income maintenance worker. And so this is someone that helps determine eligibility for services. So you may hear like food stamps, nutrition, Medicare or Medicaid, different type of government aid services, and you would help determine the eligibility for it. So you would become proficient in using the NC FAST application and building skills in communication, interviewing, time management, gathering, compiling, and analyzing data. So still very, if you're good at taking notes, data, great position. This is a two-part class. The first part is offered through the Career Services Department, and then they give us the eligible list for that part two for the MC Fast Pace worker. So if it's something you're interested in, it's typically offered in person. That way you can have some more hands-on experience learning with this software and the application. Neuroanatomy and physiology. We have several classes that we're offering for the neuro department, but the one that primarily will be of interest to the general public is neuroanatomy and physiology. This covers the anatomy and physiology of the nervous system and the diseases that affect it. The topics include anatomy and physiology of neuron, brain, spinal cord, cranial nerves, and neurovasculature. This also, if you're interested in the degree program, this is a class that is transferable to their program. So we have people that teach part-time with them that teach classes for us. The department head actually may be one of the instructors for this class. And then we also have another full-time person developing a leadership class for neuro departments at hospitals. Nurse aid, this is probably our most demanded class for many reasons. And so you may hear it also as a CNA, Certified Nursing Assistant. It introduces you to the basic nursing skills, basic life support for a healthcare provider, CPR, remember through the American Heart Association. A few things to look that you'll need, you have to have physical and immunizations and a social security card for taking the certification exam to get that licensure. So we offer classes at Health Science Campus, Public Safety Education Campus, and Scott Northern Wake Campus. And we have day, evening, and what we call what was labeled as weekend, but like a Friday, Saturday. And there's they're offered at different times at different campuses to try to meet the availability of the students. These classes do fill up very fast because some of our programs, like nursing, sonography, and radiography, require the nurse aid licensure. And that way, then we also have people from other schools taking it for their programs, or people trying to get into like PA school. So the question in the chat, so CPR is included within the course, or you need to do it beforehand? That's a great question. It is not included in the class. It is something that you don't have to do it necessarily before the class. If you get it done beforehand, great. Again, it's something that you can start working on now. You would need to have it by the clinical prep date, which is typically a few weeks before the end of the class. It varies with each schedule and how often they meet in the class. So you don't have to have it by the first day, but you do have to have it, I would generally say, about the midpoint of class. And that'll be the same for the phlebotomy class that we'll cover as well. So our instructors for that are all nurses and that have practice. Some of them are currently still working at the hospital. So we have a nice variety of instructors. These classes will either be blended or in person. I think the vast majority are now blended. We may have one or two instructors offering all in person. And then if you already are a nurse aide, we have refresher classes and nurse aide 2 classes that we offer as well. All right, phlebotomy. So if you're not good with needles and blood, maybe not the profession or course for you, but if you're okay with those, great course. Must be 18 years or older. Again, the BLS for healthcare provider CPR, physical and immunizations. So the primary responsibility for a phlebotomist is collecting blood specimens from patients for laboratory tests. They have expanded since COVID. A lot of the responsibilities or additional tasks that a phlebotomist can do And the department head for the medical lab technology and phlebotomy program on the curriculum side, she shared that this is a huge demand in the workforce, and there are just not enough phlebotomists in the workforce. So we have a rather lengthy interest list for this class to try to get people in. We've added a few evening classes to try to help meet the demand of those interested, and of course, help people get into the workforce. All right, so upcoming classes, looks like my slide didn't update, but that's okay. So some classes that we are looking forward to. We just hired a few people for mental health technicians, so we're hoping to have that up and running in the spring. We're still looking at disability support specialists and what that may look like, and try to help meet some of the needs of what the hospitals need or other facilities in our area. Dialysis technician, our provost and dean reached out to us about researching that class, so potential for that. And then 2 classes that we're also looking at: medical translator, interpreter, and that would primarily be for English, Spanish, and that's a need that our pharmacy tech students need, and we've seen a demand for that in our bilingual community as well. We may look at offering it in other languages, but the focus will primarily be English, Spanish. Another department does also offer a medical interpreter class that you can look at in our catalog as well. And then certified prevention specialist, and that would primarily deal with substance abuse. All right, so that leaves us, I believe, about 10 minutes, maybe a little less, for questions that anybody may have. Oh, perfect. Does phlebotomy need a high school diploma or GED? Last I spoke with the department head, it is 18 years or older. We do, some certifications do require the high school diploma or equivalency. We don't really use GED anymore because it's trademarked or copywritten. So the high school equivalency, and we do have another department if that is something that you're interested in. College and career readiness, they offer courses and classes to help you with that. Central sterile processing technician, when will it be offered again? It will be offered in January. So we're working on confirming schedules with our instructors. So I'm hoping to have them posted this week, if not early next week. And typically we have about, I think it's every 2 weeks having a class starting to try to meet that demand. So if you don't get into the first class that we post, there will be other opportunities to get in. And then also check in the details of those specific classes, because it does have the in-person components for 2 nights. And so especially if you're not in the area, you know, you want to incorporate travel time to meet. So typically it's on a Tuesday night, 6 to 9 o'clock in the evening. Access to the PowerPoint. I don't think they post the PowerPoints, but I mentioned earlier, Paul is here to help us with the class, and the video will be posted online. If you have any questions, I will put our department information in the chat as well. That way, if you think of any questions, maybe after our session, or as time goes on, you can always give us a call or email. I may be the person to answer the phone or email you back, but it may be another staff member in the department.
Yes, Samantha, I have a question.
Sure.
What about the medical billing? Do you have to have a high school diploma for that?
So you do not have to have a high school diploma for the class. Let me double check some of the certifications require it. So that's where we look at that. So give me 1 second. I can look at our catalog and double check that. Great question. Go back to the nurse aid slide. Yes, I can go back to the nurse aid slide. Sterile processing require, it does not require a high school diploma. You would just need to complete the course and you should be eligible to take the certification exam. And here's the nurse aid slide as well.
Thank you.
You're very welcome.
Samantha, I'm
Yes.
sorry. I have a question, about the phlebotomy course. Do you have to take the CPR class before you register the class, or is that the same as well as the CNA class where you have, to take within the 5 classes?
Yes, so, if you, like I said, if you get it done before the start date of the class, great. If not, typically, each class will have a clinical prep date or like a date that you have to have your documentation in by. Realistically, I'd say about the midway point, maybe a little bit sooner than that. You should have that, done and uploaded into Castle Branch. So if you are interested in phlebotomy, you can email us to get on that interest list.
Okay, thank you.
You're very welcome. Looking up a certification for fulfilling. I don't think it is. I'm not seeing anything on their website. Let's see. Oh, here we go. Experience requirements. So medical terminology, and then it goes into healthcare billing and coding. If you do not have billing experience or working towards, they recommend taking a prerequisite course, which is what we offer. So it says nothing about a high school diploma or equivalency. And we did have a comment about the nurse aid program. Yes, it can be a very intense program. A lot of information, quick time for the learning the lecture, doing the skills, and then going into clinical. Definitely be a fast pace. Interested in pharmacy. Let me get, so that's a curriculum program. So let me get the link for you for that. We are looking at offering a class with them. Oh, thank you, Paul. Paul is on it. Wonderful. So Paul put the link in there for you for pharmacy technician. And so we're also looking to work with them on a sterilization class as well. That would be eligible to transfer into credit for their curriculum program. CPR, how do you sign up? CPR.laketech.edu. And of course, it is not required for you to take it through us, but it is nice if you do take it with us because we're able to work with the CPR coordinator if we need to get that card and get that uploaded. So just a little bit easier internally for us. What are some options for moving in and from sterile processing career-wise? So several options with that. We have the 2 of our instructors work at the facility, at a sterile processing facility. One is a manager and the other is, I think he's like a supervisor level. And so they work together at a facility where their other instructor works at a hospital and works in management. So definitely different career options for that. So sterile processing, there are the basic levels as well as going into management. So getting experience and moving up from there. Sometimes that's a good segue into surgical technician, which, like I said, we don't offer to the public right now. It is something we're looking at doing in the future, just a lot of moving parts to get that running, but the hospitals are the ones sending people. So that could be a possibility. It also could be a entry into healthcare in general. And so we have a lot of people that may start out as like nurse aide, and then they say, well, I want to do EKG or phlebotomy. They just want to build on their skill. So different options and really many ways that you can go through and learn about the different things that it can go. And then we also have, like I said, the career services. They can help with career exploration, but also another huge part that they play in is resume writing, resume building, interview skills. They do mock interviews. So they have job opportunities. They send those out. They also do job fairs for different areas. So like they have a caregiver job fair coming up next week. Different options for that as well. So I think that kind of, starts with going to different avenues of the class and then looking at what's available in your area. Again, some of these you can apply for positions that are non-certified. Some of them will hire you with the expectation of you to take the class and then to get certified. So different options with that. Paul put in the chat for us that they'll send out an email. So someone from the college will send out an email with the recordings. It'll probably be a few days after this to get the recordings uploaded and for sharing. Perfect. How often are the CPR courses given? They are typically almost offered every Saturday. And then occasionally, if it's split up into 2 nights, it'll typically either be Monday, Wednesday, or Tuesday, Thursday, and offered probably 5 to 9 or 5:30 to 9:30. So broken up into several different options, but typically every Saturday, and they can only offer multiple times a day. Depending on what's on the website right now, their technical assistant is always working very hard to get their classes posted. So if you don't see one or they're full right now, there will be more classes available for registration. Again, that's not one that our department offers, but I do love to promote it because it's a requirement for some of that clinical paperwork. And it also is a good thing to have for your classes in general and for any healthcare position. Great questions. Paul, I think that puts us at time. Is that correct? Or we have a minute or two left for questions?
I think we can hang out for a little bit if there's questions.
Perfect.
Your call.
Wonderful. So if you have any more questions, I'll hang on for a few more minutes. And then if not, you may have signed up for a 6 o'clock session, and that will go over some different topics as well. So if you maybe were interested in a different session, again, Paul said they'll be sending out the links to those as well. So you can review this, or if you have any questions, again, feel free to reach out by phone or email. And thank you everyone for attending. We appreciate everyone being on and learning about our different programs.
Thank you, Samantha, for all the information.
You're very welcome.